Hi, welcome to today's episode where we are blessed to have Jeff Hinton, who is the founder of Caradigm Benefit Advisors, with us. Now, Jeff, I actually met you when I worked at a prior wealth management firm, but you had an interesting story. You came to the insurance side of things after being on the hospital administration side of things. And I found it really insightful how you were talking to our clients about Medicare original supplement plans versus Medicare Advantage. And we're going to dive more into that in today's episode. You're tuned in to the Matchpoint podcast, How to Win the Money Game. I'm your host, Thomas Cook, financial planner and founder of Retire to Teleco, a wealth management firm in Knoxville, Tennessee. And together, we'll navigate the financial court of life to help you maximize your wealth and minimize taxes in retirement. Is there anything else that you'd want our audience to know about you, who you are, why you started Caradigm? I think that is an interesting story and a good place to start.
Sure. Thanks, Thomas, and thanks for having me today. Like many people, for a number of years, I had a corporate job and had benefit plans and sort of took whatever they served up for me. But when I was CFO of Medcath, I would actually be negotiating participation in healthcare panels. And so we would see all the Medicare Advantage plans and the offers that they made us. And it was kind of interesting to me. They would never pay as much as Medicare. And they said, well, we have this great list of enrollees. And if you want to participate in those plans and have access to these patients, you've got to agree to like a 10% discount to Medicare rates. And so I started drilling down, should we do this? And yes, you have a lot of fixed costs in healthcare. And so it's still advantageous to take a little discount, but it really made me curious as to what the Medicare Advantage world was like. And even before that, at Matria Healthcare, the analysts that would cover Matria would also cover the managed care sector, and Medicare Advantage was just the rage. I'm like, how are they making so much money on Medicare Advantage? And so, long story short, it caused me to ask a lot of questions along the way, both in terms of helping my family with their care, as well as looking at options for beneficiaries. And I think I've learned quite a bit in that journey, and I'm happy to share it with our clients. So thanks for having me, and delighted to help your audience any way we can.
Yeah, and I appreciate that you had the curious mindset to dive a little bit deeper. Yeah, and I'm eager to hear everything that you found. But anytime there are Super Bowl commercials for something, I think it probably is a good practice to follow the money and see, why these Medicare Advantage plans may be pushed as much as there, and they can be a good fit for people, to be fair, and I'm sure we'll talk about that. And maybe even before we get to Medicare and choosing between original supplement versus an Advantage plan, what options are available for those needing health insurance after retirement and before being eligible for Medicare?
Yes, that's one of the very frequent things that we deal with. First of all, people will commonly assume that we have to sign up for Medicare when they turn 65. And so the answer to that is no. You do not have to sign up for Medicare when you turn 65. If you're collecting Social Security, you'll be signed up automatically in Part A and Part B, but you have the option to opt out of Part B if you want. But the key there is, are you on a plan from your current employer or your spouse's current employer? So as long as that's in place and as long as you want to keep working, you can do that even when you turn 65. But the other issue that we have quite frequently is someone wanting to retire. In fact, 10 minutes ago, I spoke with someone who's 62 years old. They want to retire, and their wife is several years younger than them. They're 62. Their wife is, I think, in their late 50s. And what options do I have before turning 65? And essentially, we've had over the course of the last 7 or 8 years, two options. One is the marketplace, and the other is a short-term plan that is true insurance, but it has limitations on it. Namely, it is an underwritten plan that will not cover pre-existing conditions. Because of recent changes from the Biden administration, that plan will no longer be available as of August 31st. So the window on that is running out very quickly, and that will leave us pretty much to the marketplace plan. And we will often compare COBRA with a marketplace option, because you'll have COBRA for 18 months. That may get you to Medicare or a long way towards Medicare. But we will look at that, and that analysis always comes back to income. Your benefits as well as your premium are going to depend on your modified adjusted gross income. And working with financial advisors, we may have the ability to use some non-taxable money before age 65. If you have Roth accounts, for example, and you can draw on those more heavily before turning 65 to take advantage of premium tax credits and plan modifications. To give you sort of a best case scenario, and this is best case scenario, but a couple with household income, taxable income of $27,000 is able to get a plan for no more than an $1,800 out-of-pocket maximum per year at less than $200 a month. And that's maxing out on both the plan modification benefit as well as the premium tax benefit.
That's an extremely good coverage amount for an extremely low premium. And people are wondering, how is that possible? And I think I cut you off right before you said it, but yeah, it's through those premium tax credits. And full disclosure, I actually was a client of yours in one of those short-term healthcare plans when I was transitioning between employers. And then we've worked through several clients together thinking about the premium tax credit and the income planning. And a lot of times what I've seen work better even than the Roth account is if they have like a taxable brokerage account that they can pull money off. Maybe they sold an investment property, a business, or have an inheritance, or they just saved more into their investment accounts than they could in their retirement accounts. And so it's this taxable account. And what I've seen is we've been able to do Roth conversion. So pull money out of a 401k or an IRA, pre-tax money, convert it to Roth. And that's the money that's generating the income to qualify for their modified adjusted gross income amount to get the premium tax credit. And then they're living, so even though their tax return is saying, hey, $30,000 a year, $80,000 a year, whatever, that whatever range that we're trying to maximize both the Roth conversion, they may be living on a lot more than that because of the money they have in the taxable account, and then they're getting subsidized premiums for healthcare. So it really is a beautiful thing.
So yeah, one of the things to be aware of in terms of the marketplace plan, and we have no way around this, is that they only offer EPOs. That stands for Exclusive Provider Organization, which is a way of saying there's no out-of-network coverage. And in addition to that, there's no out-of-state coverage except for emergencies. And so those are just two things, we have no way around, and you do need to be aware of. Some of these networks are very limited. One of the big plans that's out there right now is called Ambetter. They have really good primary care coverage, but when you start drilling down on that network with things like general surgery and orthopedics and oncology, it's a very limited network. So it helps to really put those doctors in and make sure everyone that you need access to is covered. But other than that, it's a pretty good option and something that a lot of our clients have taken advantage of.
So let's talk about this a little bit. How should people understand their options when they're first enrolling into Medicare?
There's really two big decision points you've got to reach. The first one is whether you want original Medicare or Medicare Advantage. And then based on that decision, you've got to decide which direction to go, having made those two choices. Most of our clients, I would say, select Medicare, original Medicare, once they understand, the first decision point. But let's start with that one. In terms of Medicare Advantage or Part C, first of all, I refuse to call it Medicare Advantage. Medicare Advantage should be called Medicare Alternative. It is a totally different plan. You're not an original Medicare, and you have to opt out of it in order to get to a Part C or Medicare Alternative plan. The best way to describe it in general is think of it as a trust. Would you elect a trust for your healthcare expenses, to which is contributed over $1,000 a month based on research data that is out there? The most current of which I've seen is 2019. But as of 2019, Medicare Advantage or alternative plans are receiving over $1,000 a month from the Centers for Medicare and Medicaid Services for all participants who have opted out of original Medicare. So do you trust that trust to receive that money every month, knowing that they get to keep whatever they don't spend and ensure that you get the highest level of care that you're entitled to? Just because of the natural conflict of interest, let's just call it what it is, I've got a problem with that. I just don't like that design, knowing that whatever is not spent on me is going to help someone else make their earnings and their profit targets. So a lot of people don't understand that. And so that's the first structural thing you need to be aware of. That's why many of these plans, though not free are premium free or do not have added premiums because of the substantial sums that are coming into them every month. The second thing to be aware of is, of course, the networks. With original Medicare, you do not have networks. Every physician, hospital, diagnostic center that accepts Medicare patients will receive original Medicare. But because there are terms and conditions and utilization reviews and discounts, not everyone is going to be in a particular Part C plan. And so you do have a limitation of choices. And so here's the issue that we commonly see. Someone comes in and they are considering a Part C plan. They want to know if their primary care doctor is in. Well, they like the Better plan on the marketplace. They do a good job of getting a lot of primary care doctors in. But what if 5 years from now, you get some kind of diagnosis that you've never been treated for in your life? I think the most likely next step you're going to have is either you're going to know someone who has had that condition, or you're going to start asking around and you're going to get people telling you the good and the bad experiences. And at the end of that process, you're likely to say, I want to see Dr. So-and-so. Then if you're on a Part C plan, you're completely at the mercy of that physician, if you want to go to them, to have signed onto the panel of that plan. Otherwise, you may have limited coverage or no coverage at all, depending on whether you're in an HMO or a PPO. So it's just so difficult for someone to know in advance who they might want to see 5 years from now. Whereas there's a much greater chance you're not going to have to worry about that if you're in an original Medicare plan. The other thing is when you look at the ability to go back, what if you try Medicare Advantage or alternative, you don't like it, and you want to go back to original Medicare? People will often say, hey, I'll use a Part C plan while I'm healthy, and then if I get a rare condition or I'm not happy with it when I'm sick, I'll go back to original Medicare. Well, the issue there is you probably won't be able to do that. You have two general guaranteed issue rights to get a supplement to original Medicare. Without a supplement, you could be stuck with no cap on your expenses, up to 20% of the Medicare charges for outpatient services, and over $1,600 in deductible for Part A admissions into hospitals. So if you wait until you have a condition, that very condition could be the one that prevents you from passing medical underwriting. So the guaranteed issue periods are A, your first 6 months under Medicare Part B, or secondly, if you try a Part C plan and in your first year of that plan, you decide to opt out, then you also get a guaranteed issue period. But aside from those two items, unless your plan has like lied to you and you can prove it, or has gone bankrupt or out of business, you have no ability, no right to go back and get a Medicare supplement of your choosing. You have to pass medical underwriting. So a lot of people don't understand their potential limited ability to get out. And then finally, with the supplements that we recommend, your out-of-pocket for everything except retail pharmacy can be as low as $240 a year. That's because between Medicare and the supplement that you choose, everything else is paid for between those two companies. So while there will be a monthly premium associated with the supplement, somewhere usually around $80 to $140, depending on age, starting at 65 at least. It's $80 to $140 for the plans that we represent. You can avoid that premium by going to a Part C plan, but you may have a $3,000 or higher out-of-pocket expense. So what have you really gained by going with the Part C plan if that were to happen? So those are kind of the two major decisions you have between original Medicare and Part C. Then the second decision as to which supplement you should choose, this is where it gets pretty tricky. In fact, you might say sneaky on the Medicare supplement side. We've chosen to represent two companies, Blue Cross Blue Shield of Tennessee and Mutual of Omaha. We could offer a dozen Medicare supplement companies if we chose to. But these are long-standing companies that have done a very good job and have a very good reputation in Medicare supplements, and they do business differently. Blue Cross does business differently than anyone else that we've come across. The way Blue Cross does business is they put everybody in the same entity, the same legal entity, and they keep it there. In fact, about 12 years ago, when they changed from Blue 65 to Blue Elite, they changed their branding around Medicare supplements. They allowed everyone in Blue 65 to go to Blue Elite with no medical underwriting. And so because everybody is in the same pool, you would expect a premium that's higher, and they are. They start out usually about $30 or $40 a month higher. When you compare that to the rest of the industry, like Mutual of Omaha, they will write through subsidiaries. I could show you our booklets over the years, but a few years ago they wrote through United World Life Company, a Mutual of Omaha subsidiary. And then in 3 to 5 years, you would expect them to sunset that subsidiary and write no new Medicare supplements in it and introduce a new subsidiary with lower rates to offer for the next 3 to 5 years. So when that happens, people whose subsidiary or their Medicare supplement provider is sunset, they are in a high risk pool because everyone who can get out of it and get the lower rate is going to go through their medical underwriting questions and pass them and enter a new company. And so if you become sick and you can't pass medical underwriting, you're in a high risk pool that you cannot get out of. And so again, that's something that you don't see in the brochures. They don't explain that. A lot of people don't understand it. And once they understand it, many of my clients just say, put me in Blue Cross to start with. That way I would expect more price stability. I'll give you some specific examples. There was one family that came to me earlier this year that had a Medicare supplement that was about 30% less than Blue Cross up front. And they've been in it for 5 years. Over that 5 years, their premiums have increased 80% over their base premium. Blue Cross in the same period, although it started higher, has only increased 40%. And this year is the year that the two crossed over and Blue Cross is less expensive. And so, again, you may have a few years of savings, but are you making the best long-term decision? So we offer both. We let clients decide which they want, but I think these are important things you need to know when you turn 65 because you may have to live with your decision for the rest of your life.
That is fascinating. Thank you for getting into the details of that and talking about the guarantee issue period. How often do you see somebody after age 65 regret the decision and want to go back, but then have a hard time with underwriting? How often do you see that?
When I see that, it's usually a child who is going through their parents' financial affairs and they realize they're paying $300 a month for a Medicare supplement. And I see this actually go both ways. I had someone whose mother was 84 years old. She was paying over $300 a month for a Medicare supplement. The first question I ask is, do they have any health conditions? And this particular scenario, her mother was fit as a fiddle. We put her in a Blue Cross plan, saved over $100 a month, and never looked back. More often than not, however, they do have medical conditions, and there's nothing we can do. Their only alternative to those rates is to go to a Part C plan, and again, for reasons already stated, we're not very likely to recommend that. But in some cases, if you just don't have the money, it's your only option.
And I love how you called it not Medicare Advantage, but Medicare Alternative. I've even heard some people joke and call it Medicare Disadvantage, just because there have been some situations where somebody was traveling, had an injury, got treatment, wasn't covered, and then they're stuck with the entire bill. And so even though they saved up front on the premium, it bit them long term. Now that won't happen to everybody. What would be, in a summary, in a nutshell, what would you say, where does Medicare Advantage make sense? Like, where do you think this Part C Medicare Alternative actually is the right fit?
Two scenarios. One is there are some budgets that simply don't have the money for a supplement. And even $100 a month just doesn't fit in some people's budgets. So your out-of-pocket expenses on a Part C plan are going to depend on utilization. So most of them have some sort of co-payment or co-insurance arrangement. So you get to save your money until you need it, but you do have to pay for these episodes as they may be encountered. So that's one scenario if your budget just does not permit it. The second scenario is those who are disabled. The cost of a Medicare supplement for someone under 65, because it is by definition a disabled population, can easily be 3 times the cost of someone who is 65 or older. And because you may be very limited in income as a disabled individual, you may, again, have no choice but to get a Part C plan. But when that is the case, you do get a guaranteed issue period upon turning 65. So you may not have to live with that decision forever. So that's something that we often do recommend. And I think almost every scenario that we've seen of a disabled individual, they have taken a Medicare Part C plan and then still preserve their right to get original Medicare with a supplement when they turn 65.
Again, I know we've talked about this, but just want to make sure my understanding is correct and everyone else that's listening to this. If you think you're going to be active in retirement and mobile, traveling a lot, crossing state borders or international, wouldn't you almost always suggest a Medicare plan with a supplement, the original with a supplement, just so they don't find themselves in that situation where they might be with an out-of-network physician? Am I thinking about that correctly?
You're exactly right. That's one scenario where the absence of networks in original Medicare is a real advantage. So if whether you're in California or New York, anywhere in the country, you do have access to every provider who accepts Medicare patients, and so that's a real advantage.
Awesome. Okay. So we talked a little bit about, healthcare after retirement, but before 65. We've now talked about what happens at age 65. What about this last part? So how should we prepare for annual enrollment after your first year of Medicare?
Yes. So there's two enrollment periods each year. There's the annual enrollment period, which is from October 15th to December 7th. And at that time, you can look at your Medicare Part C plan as well as your Part D plan if you're on original Medicare. So again, if you're on original Medicare, although it does not have a drug component, you can have a standalone prescription drug plan. Almost all of our clients do. If you don't have one when you're entitled to, you may be faced with a late enrollment penalty down the road. This year, in fact, we even have a 50-cent per month plan. So there's really little reason not to be in some kind of a Part D plan. But over the years, we've seen these formularies change every single year. So we reach out to our clients every year and ask them if they're interested to send us their current prescription list. And during this annual enrollment period, we can review those prescriptions, look at next year's plans, and find the one that's best for them. And as a general rule, you can expect to need to change plans at least every 2 to 3 years. For many years, Humana had the most cost-effective Part D plans. Then SilverScript came in. Everyone was on SilverScript. Now, for the last couple of years, WellCare has really driven the market in these plans. And that's just normal. It's going to change every 2 to 3 years. And if you haven't looked recently, you need to look every year. In addition to that annual enrollment period, there is a separate general enrollment period. And that's from January 1 to March 31st. And that's where someone who is in a Medicare Part C plan has an additional option to change their plans one time during that 3-month general enrollment period as well.
And just to recap, if later down the road, like let's say you chose a Part C plan, a Medicare Advantage plan, but you want to go back to Medicare Original with a supplement, those are the times that you could do it. Am I understanding correctly? The annual enrollment, October 15th to December 7th, or that general enrollment at the beginning of the year?
Yeah, you would want to do that in your annual enrollment period because you would want to enroll in a Part D plan, and that would cancel your Medicare Advantage or Part C plan during that annual enrollment period. The second period is only for those in a Medicare Advantage plan, and you do get the opportunity to change that plan once a year during January to March.
Got it. Perfect. But you also had said, so the annual enrollment, October 15th, December 7th, if you do switch, you now have to go through underwriting. So you may not be able to qualify. So that's kind of the risk of not making the right decision at the beginning. Is that correct?
That's exactly right. Unless you're in your first year of a Part C plan, you do not have guaranteed issue, or in your first 8 months under Part B. If you enroll in Medicare Part B in August 1, for example, you're still within your 8-month guaranteed issue period. So those are our two exceptions that are generally applicable. Again, there are some other unusual exceptions if your plan goes out of business, or if they have defrauded you or given you misinformation, things that we don't typically see. I don't think I've ever seen a scenario where someone alleged either of those two exceptions. But aside from those, you have to be in your first 8 months of Part B or in your first year to avoid medical underwriting. Medical underwriting, just a note on that, it's pretty comprehensive. For example, the Blue Cross Blue Shield underwriting questions have a very general statement that disqualifies you, like, do you have any circulatory system disorders? And the only exception they give is just general high blood pressure. If you're on a blood pressure medication, that's not considered something that would disqualify you. But other than that, I've talked to a lot of people that have some sort of circulatory system issue. It may or may not be causing them problems. It may or may not even be treated, but it is a circulatory system issue. And so between that and cancer, we see a lot of people who may have cancer in their past. They're doing fine. They may have had a melanoma removed 2 years ago and have no issues whatsoever, but they can't pass medical underwriting. So there are a lot of things that can disqualify relatively healthy people from passing medical underwriting.
Yeah, thank you for expanding on that. I was gonna ask that. What were some of the common things you see disqualify somebody? So let's talk about this. Can you tell me a little bit more about the changes to Part D in 2025?
Yes, actually, 2025 is the year we've been waiting for. A lot of changes are coming out to Medicare Part D plans. So again, this would apply to someone who is on original Medicare and has a standalone prescription drug plan. So the first thing that's happening next year is, we've all heard of the donut hole, also called the coverage gap, where you have a copayment and relatively low costs up front, then you have substantially higher costs and a manufacturer's discount during the donut hole. And then if your costs persist, you go into the catastrophic component. Well, for 2025, that donut hole is gone. There's still deductibles and so forth, but you do not have that coverage gap in the middle that you have to deal with. The second thing is, there is a cap on your out-of-pocket expenses. It's called a TROOP, which stands for a true out-of-pocket cost, and that cap is $2,000. That is substantially lower than it has been in the past for those who have some expensive brand name medications. So that is going to lower the costs for some people. The other thing is, even those who have a limit of $2,000, if you have a very expensive medication, have to pay all of that in January and February, you can be out a lot of cash flow the first 2 months of the year. There's another feature for 2025 where you can sign up for essentially a payment plan, where you pay 1/12 of your $2,000 every month, or a little less than $170 a month, and spread those costs evenly throughout the year. So those are certainly some enhanced features, some enriched features, if you will. So that's good, right? The other side of the coin, however, considering those, is that with all the people that we meet with, I would say, it's just anecdotal, I would say less than 20% of our clients are hitting that catastrophic coverage period. And many never even hit the donut hole. Many have like 3 or 4 generic medications. They never even hit the coverage gap. So these features, unfortunately, are likely to have the effect of raising Part D premiums to pay for the features. And I would expect, based on what I see, most people would not benefit from them, again, if they just were having some generic medications. So those plans will be available to us probably in early October. We'll start to see what those Part D premiums are for next year. But at least if you're one of those with some relatively high medicine costs, you've finally got some relief coming next year.
That's good. Great news. The year we've been waiting for, as you said. So Jeff, as we wrap up this podcast, why don't we do this? Why don't you just give us your 30-second summary, high level, the most important things we covered today that you hope will stick with our audience, and then after that, I will open it up for you to share your information in case anyone wants to reach out to you directly for your consulting on their situation. So with that, could you give us just your high-level recap, the most important takeaways of today's call?
First thing I would say is, don't hesitate to call someone and ask for some assistance. We are not compensated for individual consultations. We are independent, licensed, commissioned, and appointed agents. So all of our compensation comes from the various carriers, if you pick a supplement or a Part C plan. And so we love meeting with clients. Most of our businesses on the group side is concentrated in the October, November timeframe for January renewal. So there is no cost to you to ask these questions. And when you start getting into retirement planning and income planning, some of these questions get complex. You can see from the discussions and the items that you mentioned, Thomas, some of the planning is going to involve where you're withdrawing your money next year. And so for us to work in concert with you in the planning process is absolutely important. And it's something that we just enjoy doing. For the other 10 months of the year, we have a lot of time to set up appointments in our West Knoxville office. Again, and when it comes to your options in Medicare, we find people generally do not understand Medicare Part C. They'll come to us and say, oh, I've heard I don't want that. Or so-and-so that I know had it and loved it, but they don't know why they loved it and whether the reasons they loved it are going to apply to them. So we want you to understand you are electing a trust, getting out of the original Medicare plan, and that the plan that you select to administer your benefits for you is going to get to keep every dollar that they do not spend on your benefits. And so that usually opens some eyes and causes some people to think, well, what are my options? And we would certainly be delighted to help you better understand those differences and pick a plan that may be better for you.
Yeah, no, I appreciate that. And again, my voice of confidence in you and your expertise. You know more about this than I'll ever know. You probably have forgotten more about this than I've ever learned about it. So I appreciate having you as a local guide, a local expert. What I haven't said is that medical bankruptcy is the most common bankruptcy in the finance world, right? And so protecting yourself, you're getting the care that you want, finding affordable coverage and adequate coverage. And then even, not letting healthcare be a reason that you delay retirement or not living the life that you want to live, right? There are a lot of options, a lot of planning. So that's why the collaboration between us works so well. And I appreciate your help in being able to bring you into these conversations with clients. There will also be people who listen to this who aren't my clients, and so they may not work with you through me, but they still may want to reach out. So what's the best way for somebody to find you?
Well, our website is caredigm.com. It's like a combination of the word care as in healthcare and paradigm, CareAdigm.com. My email address is jeff.hinton@caredigm.com. And my direct office number is 865-588-3545. If I'm not in my office, it'll roll over to my cell, and we will get back to you.
If you're in Tennessee and have questions about your healthcare, specifically Medicare, Medicare Advantage, the Part C, or even maybe one of those marketplace plans pre-age 65, I would definitely recommend talking to Jeff. He'll help you get it sorted out. So Jeff, with that, thank you again for joining this episode. I learned a lot, and I'm sure that everyone that listened to this did as well. As we wrap up, remember that your financial match point is within reach. Connect with me at retiredtoteleco.com for personalized guidance and additional resources. If you found value today, don't forget to subscribe and leave a review on your favorite podcast platform. Thanks for listening. This podcast is for informational purposes only and does not provide financial, tax, or legal advice. Each individual should consult with their dedicated financial planner, tax preparer, estate attorney, etc. before making any financial decisions.